Deputy Ellis, you have 5 minutes.
But this is a government elected in a crisis, a government that promised stability, which now faces into an election on the motto of the British Tories, offering chaos or stability. For many, it is clear that the people offering chaos are actually Fine Gael and Labour. Certainly for those in housing need, for those who have lost their homes, for those who are sick or disabled, for those who are young adults or entering retirement, for those with mental health issues. This is a government of chaos. There is no stability for the people of this country who find themselves in need of the basic services the state should provide. No clearer example of this instability is in our A&E departments, where hard-pressed doctors and nurses struggle to deal with overcrowded waiting rooms, backing onto overcrowded halls lined with trolleys, often occupied by elderly people for extended periods of time that are utterly unacceptable in any context. In my own area of Dublin, we have Beaumont James Connolly Hospital and the Mater struggling to meet the needs of its patients every day. I read last week of a Mr. James Coyle of Cabra, a 72-year-old man who had to sleep overnight and be treated in a chair. He praised the staff who were doing their best in a desperate situation. The A&E department had to close its doors for a period after Mr. Coyle arrived because it could simply not do any more. Not only is the system placing great hardship and suffering on those in need of care, but it is breaking the backs of those caregivers whom we often hear lauded by the government, as long as they aren't threatening strikes or stoppages or asking the government to do more, that is. We often hear people being told to stay away from A&E unless absolutely necessary. You would have to wonder in this crisis who would go to A&E unless they had no other option, which begs the question how many people in need of care are staying away due to the widespread knowledge of the severity of this very real crisis. This is a major threat to public health, to our health workers, to our families and loved ones. Dr. James Gray, speaking of Tallaght Hospital, said of one patient, "This man, like the others, is non-designated patient conduits, have no privacy, no dignity, are subjected to constant noise torture, constant light torture, resulting in major sleep deprivation, pressure effects causing pain as lying for advanced periods on a trolley not designed for same, as well as boarding conditions that constitute an infection control hazard." It would seem in the government's eagerness to commemorate the Psalm, they have managed to recreate its conditions in our hospitals. The government will claim they inherited this mess that may have a kernel of truth, but it would be fairer to say that the government have compounded and exacerbated the mess. This is the cause of a failure to reform the health services, to tackle its two-tiered nature, to refocus funding to where it is needed, and to treat nurses and frontline doctors with the dignity and respect they deserve. It is the result of 5 years of grinding austerity, which has chiselled away at the foundations of the health service, while the government hoped and prayed for a saviour in the form of private health insurance. In Sinn Féin's most recent budget document, we showed how the government could invest an additional €383 million in health. This would have tackled the trolley crisis, improved ambulance cover and disability services, reduced waiting times and prescription charges. It was predictably ignored by this austerity government. We followed that document with the launch of our costed stage and realistic plan for health to undo the damage of this and previous governments. People are being turned away from A&Es who have mental health issues. Often there is no psychiatrist on hand, particularly at weekends. Many are left for hours on end who need urgent and immediate help. The winding down of mental health services delivered locally in Drumcondra, Clontarf and in Ballymun and centralised on the North Circular Road is another example of the double-speak of this government. In a vision for change, you outlined how mental health services would be delivered locally. And Tusnua in Ballymun, which worked with over 30 people at one stage, is now being wound down and effectively removed from Ballymun. Thank you.
Thank you, Deputy. Deputy